Well, it's time for another segment of Ask the Pros, and we're at Atlantic Hairfax in Moncton today. I want to introduce you to Larry Gautreau. And Larry, first thing I want to ask is, what are some of the options available out there for someone who may be experiencing hair loss?
Well, I'm glad you said that, because there's a lot of people that, if they're in the early stages of hair loss, treatment would vary, of course, compared to somebody who has no hair at all on the top of their head. So it ranges from surgical options, where we can implant hair from the back regions of their scalp, to wigs for cancer patients who lose all their hair, to various types of non-surgical hair systems like I have, that can be placed on where you can wear it 24 hours a day, 7 days a week. So
wow.
Yeah.
Now, is there anything out there that can slow down the process, that can maybe keep my hair from falling out as quickly as it does?
Good question. In the last, we'll say about 10 years, there's been a lot of developments with in regards to medications that are on the market now to help maintain existing hair, which is we feel is a big part of the whole process. People that are undergoing surgery, obviously, we want to try and maintain their existing hair. So there's a drug out, we use it quite often. It's called Propecia. It's a pill. Simply you take a pill once a day, and it blocks the DHT from reaching the follicle, which is 83%.
And that's what causes the hair to fall.
Exactly, yeah.
Now, we mentioned surgical procedures. What is the difference between a surgical procedure and a non-surgical procedure?
Okay, well, surgical is exactly what it says. It's surgical. So what's involved, I'll just kind of illustrate on this mannequin here. Basically, this person, you can see, is thinning through the top. Mm-hmm. So what we do is we take hair from the back regions of the scalp where it's plentiful and not being affected by hair loss, and we simply relocate those follicles into the scalp. Now, to do that, the first step of the procedure is to, of course, freeze the scalp so you don't feel it.
Right.
And we remove an actual section of the scalp containing all the follicles. It's then dissected under a dissecting microscope, and then these little tools here, we actually make little incisions in amongst the other hair, place them in, they take on a blood supply, and within 3 months you have hair that's starting to grow.
Wow.
And generally, we usually say anywhere from 6 months to a year before you see the complete results.
That's amazing, eh? Technology is amazing, isn't it?
Sure is.
Now, is there a product on the market that will actually help grow hair back?
As far as growing hair back, once the follicle fills with sebum, it's at that point it's pretty well toast, you would say. But medications to help grow back, no, I wouldn't say.
Right.
It's designed, there's medications to help maintain it.
Like the Propecia.
Exactly. But the non-surgical process is one that we do quite a few of as well, and this is more geared for clients that maybe are not suitable candidates for surgery.
Right.
Maybe they don't have enough hair in the back to transplant, or they have a very large area. So this is why we offer a non-surgical process, which is still made of real human hair. The only difference is, of course, it doesn't grow.
All right.
Yeah.
Great stuff. Well, all right, so there you go. That is another segment of Ask the Pros. Don't forget to check out the website, which is maritimepros.ca, and if you've got any hair questions, check out Larry on the website. Send your questions along.